Hello people, in this video we want to look at Beri Beri. Basically Beri Beri is a disease which is caused by the deficiency of vitamin B1, that is thiamine. Some people are writing thiamine as thiamin or thiamine. Okay, anyway, so this is a water soluble vitamin. So you have studied, guys, in water soluble vitamins. You have basically we remember only the fat soluble vitamins. Fat soluble vitamins are what? We'll write it here in the side. Fat soluble vitamins are A, D, E and K. So everything other than this list will be water soluble. So B and C are water soluble. Use of blue color and say B and C are water soluble. Give me blue. Yeah. So vitamin B, C and all are water soluble. Here you can see here. Vitamin B1 is thiamine. It is water soluble. B1. That's what we want to read in this, right? Then any deficiency of this can be associated with neurological manifestations. That's what we are trying to understand here. Beri Beri. Okay. In this chart, just look at this. Vitamin B1 is here. So basically what it is telling you that it is also called as anti-Beri Beri vitamin. Obviously anti-Beri Beri. It is where is the source of vitamin B1? Yeast, rice, bran, they are saying. Okay. And what are the synthetic or isolated vitamin? What are the names? Here they are saying thiamine, mononitrate, thiamine, something, hydrochloride. Anyways, just remember that it causes Beri Beri. Alcoholics will have this deficiency. They will have double vision. Okay. So it has both animal and vegetable origin. So these water soluble vitamins, what they are saying, they are lost in urine, etc. These water soluble vitamins have some enzyme, okay, through which they work. The thiamine pyrophosphate, it is the enzyme they are talking about here. So just look at this, guys. Here you have glucose breakdown. This glucose will become what? As you can see down here, the glucose is becoming pyruvate, right? This is what it's becoming. What is glucose becoming? Pyruvate. This pyruvate enters the Kreb cycle, isn't it? So this is your Kreb cycle. Remember your biochemistry, guys. So in Kreb cycle, we are just zooming. So here you can see that pyruvate has entered and pyruvate is becoming acetyl-CoA. And acetyl-CoA is the one that is going in the cycle. Look at this, down the circle. But anyways, look at this here. TPP, vitamin B1 is there here. Pyruvate to acetyl-CoA. Vitamin B1, the TPP enzyme. What is TPP full form? And look at this one also here. Inside the circle also one step, that is alpha ketoglutarate to succinyl-CoA. Some vitamin B1 TPP is written here. Okay, so it is there in this Kreb cycle. Basically, in two places we are able to see this enzyme being used, that is the TPP enzyme being used. So we'll have to go back to biochemistry and read all that. What is the enzyme? Thiamine pyrophosphate. Say thiamine, pyrophosphate, phosphate. Okay, pyrophosphate. Thiamine you will not forget. Pyrophosphate. Okay, pyro is difficult to remember, but phosphate, if you remember, at least you can think about pyro. Okay, so basically this enzyme is involved in the metabolism of these macronutrients. What exactly is it doing? They have told the exact thing that will do. It will do the decarboxylation of pyruvate to acetyl coenzyme A. So this is what it's doing. It's helping in the conversion of pyruvate to acetyl coenzyme A. Okay, so that is this acetyl coenzyme A is the link between the glycolysis and the Kreb cycle. Okay, then transketolase activity in the HMP pathway. Okay. HMP pathway, HMP, right? Hexose monophosphate pathway. Remember, this is an alternate pathway to the glycolysis and the Kreb cycle. So glucose will be processed here. Basically, they are producing some ribulose 5-phosphate, etc. So here you can see here the TPP again here, TPP enzyme coming here. Transketolase. Can you see this word here, transketolase, guys? This is important. Please focus here. Transketolase. Basically, we're focusing on the action of thiamine. So here you can see TPP again. So multiple places you can see TPP. Again here you can see TPP in two places at least. One is here on top here. Can you see? TPP is here and one TPP is here. So basically this is the function of thiamine. Let's not go into the depth. So basically it is also helping in the transketolase activity in the HMP pathway. Okay. Then last one, third one they are saying that is decarboxylation of the alpha ketoglutarate to succinate in the Kreb cycle. These two are Kreb cycles. So let us put it back here because we have already seen this, right? So two things we have seen, that it helps in the Kreb cycle and it also helps in the HMP Shunt pathway, TPP. This enzyme is important, thiamine pyrophosphate. So you've understood the importance of this vitamin. So guys, what do you think will happen if there is deficiency of this thiamine? Let's try to understand. Thiamin. If there is deficiency, what will happen? The cells cannot metabolize glucose aerobically. So the cells cannot metabolize the glucose aerobically to generate ATP. So obviously it's not able to do glycolysis. I mean, maybe it is able to do, but it is final energy of the outside the Krebs cycle is not coming. So what is happening? The cells cannot metabolize glucose. So if you cannot make energy, what will happen? Your brain, guys, your brain needs glucose, isn't it? Your brain is dependent on the energy from glucose. So it will not be able to get the energy because the brain and neuronal cells are exclusively dependent on glucose for energy requirement. And when there is impaired glucose oxidation, what accumulation will be there in the body? A lot of pyruvic and lactic acid will be accumulated in the body. So this will produce vasodilation and increased cardiac output. That is what they're trying to say here. See, there are two ways you can get this problem. Either you are eating a diet which is based on polished rice. Okay, you are eating polished rice. You are not eating the raw rice, unpolished one which has all the vitamins. You are eating that, or you are an alcoholic. Either ways you have got this thiamine deficiency possibly. You are not able to absorb it or store it, or you have bad diet. So basically this thiamine deficiency is there in that body. Okay. So it's written here, causes of deficiency, polished rice, the alcohol. Now let's go back to this one. Okay, here we were. So basically if you are alcoholic or you are having a diet which is based on polished rice, which is you're eating polished rice too much, then you can have this thiamine deficiency. And there are two types of Beri Beri. The disease, one is dry Beri Beri and the other is wet Beri Beri. So focus here, guys. Some terminologies are coming up here for you. Dry Beri Beri is actually neurological, guys. Here what will happen? There will be peripheral neuropathy, chronic. Okay, and these people can have wrist drop, foot drop. They can have psychosis, guys. Korsakoff's psychosis. They can have Wernicke's encephalopathy. All of these words are looking a little hi-fi to me. Right? Korsakoff's psychosis, Wernicke's encephalopathy. Okay, peripheral neuropathy is kind of okay, but this is all encephalopathy. Looks dangerous, isn't it? But anyways, these people can have wrist drop, foot drop, all that because of peripheral neuropathy, and then have psychosis and Wernicke's encephalopathy. Say these words. What is dry Beri Beri? Neurological. What will they have? Korsakoff's psychosis, Wernicke's encephalopathy. Okay. Then coming to wet. Wet is heart. Okay. Touch your heart and say wet Beri Beri, cardiac. So here there will be edema. Generalized edema, wet Beri Beri. I think we should use wet here, blue color here. And this one can be some other color. Okay, yeah. So basically wet Beri Beri is cardiac. Let's draw a blue heart here. Cardiac, wet Beri Beri, wet Beri Beri. So basically here there will be generalized edema, all because of heart issues, isn't it? By what is happening here to the heart? Biventricular heart failure. Obviously biventricular heart failure. Both the ventricles left and right are failing, looks like. Because of this, what will happen? There will be pulmonary congestion, there will be generalized edema in the body. How will that person generalized edema will look like? He'll be like this, full of edema everywhere. He'll have edema. Okay, this man is suffering from wet Beri Beri, cardiac. So what is the problem in this guy? The heart, both the ventricles are having failure, biventricular heart failure. In whom? Thiamine deficiency. So thiamine is so important, guys. So let's go here and write the treatment for Beri Beri. Okay, but what is the normal requirement of vitamin B12 that you need with B1 that you need every day? 1 mg per day. I feel like I'm remembering as 1 mg per day. It's actually 1.1 to 1.2. Okay, 1.1 for women and 1.2 for men, etc. I would like to just remember it as 1 mg per day. Okay, this is what is the daily recommended daily allowance. Okay, this is the recommended daily allowance. Now let's go to the treatment of Beri Beri. Let's go to the treatment of Beri Beri. Why do you think it's called Beri Beri, guys? Sounds like a very strange name, right? Beri Beri. Anyway, see, if it is wet Beri Beri is what? Cardiac, right? Cardiac it is. And Wernicke's encephalopathy, if it is there, then you can just give them intravenous vitamin B and C mixture, and without delay if you give, it should be fine. But what happens with the Korsakoff psychosis? It is irreversible. It will not respond to thiamine treatment. So it's too late now. If you have exceeded that, you have developed psychosis. If psychosis is there, especially the psychosis, Korsakoff psychosis, it is irreversible. That's it guys in treatment. This is the whole summary that we wanted to tell you, that you should just give them vitamin B and C mixture. C is also water soluble, right? You can give them this, and Wernicke's encephalopathy and wet Beri Beri you can treat without delay. Okay. With this vitamin B and C mixture, which how should you give this vitamin? With IV you should give, intravenous you should give, okay. Korsakoff's psychosis is irreversible and does not respond to Thiamin treatment. Okay. This is all you had to know about the treatment. Guys, look at this. There is something called as Wernicke-Korsakoff syndrome. Here it is chronic alcohol misuse. Whoever they do, they will have some brain disorder resulting from damage to the mammillary bodies, dorsomedial nuclei of the thalamus and adjacent areas of the periventricular gray matter caused by vitamin deficiencies. Exactly which parts of the brain are affected, that also they are telling, because of because of Thiamin deficiency. I'm guessing that's not important for you, but just look at this. There will be some ophthalmoplegia, right? So we told you the other time that there is some eye problems, double vision, etc. Could be this Wernicke's encephalopathy. Again, this is neurological, dry Beri Beri. And Korsakoff syndrome, we told you that it is irreversible, the psychosis. Basically here they are telling you that what exactly is there, what is the psychosis? Psychosis, right? Severe short-term memory deficits and confabulation. What is confabulation? They'll have some made-up stories, they are saying, okay, with memory deficits, and they will have confabulation, made-up stories kind of a thing, the internet says. So basically understand that this part of it, Korsakoff psychosis is irreversible, that's what they said. And Wernicke's is what? There will be some delirium, ophthalmoplegia, nystagmus with ataxia, etc. they're talking about. And which part of the brain is actually affected? The mammillary bodies, dorsomedial nuclei of the thalamus. I think instead of remembering all this, I would just like to remember thalamus. Because thalamus, Thiamin, both are TT. So I would like to go with this. Some part of the thalamus is affected. Some periventricular gray matter of the brain is affected, right? So then there will be Wernicke's encephalopathy, the nystagmus, ophthalmoplegia, ataxia, delirium, Korsakoff syndrome, memory deficits, confabulation, fabulous, you're fabulating something, fabulation, okay. So all this can happen. So what is the treatment, guys? Just we told you that you have to give vitamin B and C mixture. In pregnancy also they give Thiamin, isn't it, guys? You have seen that. See, they have written here, Thiamin, how much should be given extra for a pregnant woman? You should give 0.2 milligram per day. See, normally any woman requires 1.1. How much do I need? 1.1 milligram per day. If you're a boy, how much you need? You need 1.2 milligram per day Thiamin. And how much you will add in pregnancy? You will add 0.2 milligram per day. Okay. 0.2 milligram per day. That and all you don't need to remember. But remember, even in pregnancy, they give this. If you want to look for self-treatment, you should eat meat, nuts, seeds, beans, legumes, seafood, dairy products, etc. You can look for. And cut that alcohol. Let's take a recap, guys. In this video, we looked at Thiamin. Basically, it is vitamin B1. It's a water-soluble vitamin. The daily requirement is 1.1 to 1.2 milligram per day. And the deficiency can be caused in a person if he is eating polished rice or if he is consuming alcohol with poor diet, etc. The deficiency of Thiamin is called as Beri Beri. Basically, it is very well distributed in vegetable and in animal origin food, like especially the unpolished rice, you should remember, then meat, beans, legumes, seafood, dairy products, etc., etc. A lot of things are there. Nuts, seeds, etc. Basically, what you should understand is that this Thiamin has this enzyme, it forms this enzyme called as Thiamine pyrophosphate. This enzyme is very, very important for you in your Kreb cycle. Okay, so there are two places in the Kreb cycle which uses this enzyme, right? Thiamine pyrophosphate. Those two places are the decarboxylation of pyruvate to acetyl coenzyme A, decarboxylation of alpha ketoglutarate to succinate and Kreb cycle. So where is the Kreb cycle? Please give me Kreb cycle. See, in Kreb cycle, which you saw pyruvate to acetyl CoA, you can see TPP here. I'm not zooming, just see here, TPP is here. TPP, thiamine pyrophosphate, and then you have a TPP here which is converting the alpha ketoglutarate into succinyl CoA. So these two are the steps in which this enzyme is required. Basically after glycolysis comes your Kreb cycle, so it is important for breakdown of the glucose and produce energy for you, isn't it? Then even in the HMP Shunt pathway you have this trans-ketolase activity which needs the which is going to help in the HMP Shunt pathway. Look at this here, there is a TPP here, you can see. Trans-ketolase, that is the enzyme they are saying, and then here also there is one trans-ketolase, okay, TPP. So this is where the thiamine comes in to help you to make energy. Now, what will happen if you cannot, you do have thiamine deficiency, you cannot metabolize glucose aerobically. So, you will be deficient of energy. Especially the brain cannot survive without the glucose deficiency. So, what will happen? The brain, it is a nervous system symptoms will be there in these people, right? So, that's what you saw. They'll have ataxia, the peripheral neuropathy they can have, wrist drop, foot drop. So, the nerves are affected. Right, and these people will also have some cardiac things. So this should be actually blue. Cardiac is called as wet Beri Beri, isn't it? And the neuronal part of it is actually the dry Beri Beri. So there will be, why is the heart also affected? Because of the accumulation of pyruvic and the lactic acids, they produce vasodilation and increase cardiac output. So you have two types of Beri Beri, dry Beri Beri, which is neurological, where you can see peripheral neuropathy, wrist drop, foot drop, Wernicke encephalopathy Korsakoff psychosis, which is irreversible. Then you have wet Beri Beri, which is because of the cardiac causes, which is nothing but the cardiac issues. So there will be biventricular heart failure with pulmonary congestion. So this person finally will have generalized edema. Okay. So they will have biventricular heart failure with pulmonary congestion. This will lead to generalized edema. Okay, so these people will have, what and all will be the symptoms of these people, guys? So they will have general pain, weakness, vomiting, difficulty walking, gait we told you, numbness in the hands or feet because of peripheral neuropathy, paralysis of the lower legs they can have. Then because of the heart, they can have increased heart rate. They can have shortness of breath, pulmonary edema, they told you, right? There will be swelling in the legs and feet. They can also have shortness of breath and they can wake up in the night. Okay, that sounds like a paroxysmal nocturnal dyspnea. So basically in the brain, what and all is affected? The thalamus, the mammillary bodies are affected, the periventricular grey matter is affected, etc. Then Wernicke's encephalopathy, what and all will be there? Nystagmus, ophthalmoplegia, ataxia, delirium. And in Korsakoff's syndrome, what will be there? Memory deficits and confabulation, that is made up stories. Okay, that and all they can do. And that Korsakoff's is irreversible, they told you. Treatment for Beri Beri is that you give them intravenous B and C mixture. Okay, whether it is dry Beri Beri, that is the Wernicke's encephalopathy, or the wet Beri Beri, which is of the heart tissues. You anyways give them what is the cause here? The vitamin B1 deficiency. So you give them intravenous vitamin B and C mixture. Korsakoff psychosis is irreversible. It does not respond to thiamine treatment. That's the treatment, guys. But look at this. These are the capsules which have vitamin B complex with vitamin C. These are tablets actually, not intravenous like we told you in the treatment. Look at this. What and all it will have. How much thiamine they are giving, you know. This is actually very less. 10 mg is there here. They can give 100 mg in the injection. And it has all the other vitamin Bs and it has even vitamin C, right? That's what they said. Ascorbic acid, yeah. Vitamin C also it has. What is biotin? Vitamin B7 is biotin, guys. B7, okay. Anyways, so a lot of vitamins they are giving. Riboflavin is what? Vitamin B. Vitamin B2. Pyridoxine is vitamin B6. Vitamin B12 they are giving. Niacinamide is niacin, yeah, vitamin B3, right? Niacinamide. Then calcium pantothenate. What is that? Calcium pantothenate? It's the calcium salt of water-soluble vitamin B5. B5 is what? What is B5? Pantothenic acid, is it? Pantothenic acid. Okay. Vitamin B5, that only is related to this calcium pantothenate. Okay. Then everything else you understood, right? Folic acid, you got it? Vitamin B9 it is. Folic acid is B9. So, lot of vitamin Bs and they have added calcium. Okay. B1 is there. 1 is there. 2 is riboflavin. It is there. 3 is niacinamide. Yes, it is there. 4 is, okay, doesn't have a name. 5 is calcium pentathenolate. It's there. Then 6 is pyridoxine. Pyridoxine is there. 7 is biotin. Biotin is there. Folic acid is 9. Is it? 9. So, there's nothing called as 8. So, 9 is there. Vitamin B12 is there. Yes, vitamin B12 is there. So, all the B vitamins are there here along with ascorbic acid, which is vitamin BC. Okay. Say vitamin C. This is the tablet form. Okay. So, you can see thiamine here they're saying 10 mg. But actually in the injection, this is the composition. In the injection, the composition is this one. Let me write it here. the injection, the composition is coming as thiamine 100 mg, vitamin B6, cyanocobalamin, that is vitamin B12, vitamin B2, that is riboflavin, nicotinamide B3, pantothenol, vitamin B5. Okay, so that is what is the composition here. It is 100 mg, and in the tablet is actually 10 mg for thiamine. In this we are focused only on thiamine, isn't it? So in this video we have completed looking at thiamine and the deficiency it causes. Very, very okay. That's it for now, guys. See you in the next video. Bye bye.